we all see healthcare is changing, reimbursement will be changing, and the mode of how we have to take care of our patients will be changing as well. So, I think together, I think we're all sitting at the table saying, okay, how can we provide better, more effective care at cheaper, so they're not as costly. And I think that's where the partnerships really come together quite well, because I think everybody has the same thinking and methodology in mind. So, when the idea of how EMS competes with home health, I never really got that. It's like, this is actually, if you look at it and break it down, it's actually a very good collaboration, because, home health care is, we're there for disease state management, education, and rehabilitation over, a period of time, over an episodic period of time. And then, EMS fits in a kind of neat role in there, as we say, I think they're a really key part for this interprofessional service, because what happens is we go to the home a lot of times, our nurses can go to the home, and they have no idea what to expect. So they have no idea how to view that home, they have no idea how to get in the home, they really may not know what caregivers may be in the home. So they're dealing with a lot of surprises, and sometimes we get what we call started cares that can't happen because we did not know the home environment. So we can get that one piece of the picture taken care of up front, which we're trying to do the pilot here, say, well, okay, now we know what's going to go on in the home. Okay, you know what? The doorbell doesn't work. In fact, you have to go around the back side of the house to get in. You have to knock on the door, and you have to call down to the daughter to come up to get you. I mean, those are things we would never know without, having someone, without EMS come in and provide those services. But I think even beyond that, there's further collaboration, as Laura and I have been talking about. We have an on-call service, so we do 24-hour calls, but that's not our specialty. I think it's probably very rudimentary, where I think EMS has much more highly sophisticated model for that. So if they can start taking these calls, help us triage those calls. And for us, it's very difficult to get a nurse out to the home at 2 a.m. Well, it might be much better to have an EMS service go out, paramedic go out to the home, visit that home, and say, okay, what is truly going on? Because I don't know how many times there's more anxiety attacks that the patient's having in the middle of the night than a true need to come to the ER. So those ways we can start working together, and I think it's a really neat project. I think hopefully will make a difference for a small community here.